Hey everyone, it's Dr. Rick with an unboxing on Avexia's THCA. This is a product from the medical cannabis dispensary locally. The closest dispensary to me is in St. Charles, but I've also been to Mindful, Triple C is part of that in Naperville, and Verilife and EarthMed. I really support them all. I think that all the dispensaries in Illinois are doing their part as far as getting good products out to the public. And this is not just for getting high. I have a lot of patients with fibromyalgia, with Crohn's disease, with PTSD, and with cancer that we're turning the corner as far as using a layer of, medicine to make them more successful, make them warriors. So depending on the cancer you have and how bad it is, usually requires chemotherapy and or surgery to debulk, and then follow-up chemotherapy afterward, like for breast cancer. But regardless of the protocols that your oncologist has put together for you, getting through the protocol and chemotherapy, for those of you who don't know, typically is given in a burst. And so the idea is if you burst expose to something, whether it's radiation, and I didn't mention that too, that's also part of the chemotherapy or treatment plan, whether it's chemotherapy, radiation, or surgery, you're trying to rid the person of the cancer that grew from normal cell. So, I mean, if you cut off half the body, you win as far as getting rid of the cancer, but you kind of kill the patient. That's not what we want. And I think that with the advent of chemotherapy and chemicals and synthetics, Siddhartha Mukherjee put together a book called Emperor of All Maladies, and it was pretty cool about the evolution of chemotherapy and cancer since World War I, World War II. Pretty cool. The idea for this video is to show you the benefits of THCA. That's how you spell it, THCA. It's just an acronym for actually tetrahydrocannabinolic acid. Technically, it's called THCA-A. But don't worry about the nomenclature. The idea is that this thing is available in Illinois for most of my patients that have cancer. If you're a doctor, because of the institution that he works at, cannot get you certified, come to me online. I'll put a link down below. As long as we have the proof, the documentation, I'll get you certified. Then you can go get this stuff. You can probably get it at a regular dispensary that's recreational without a medical certificate. They're not going to house it because it's not going to be a big mover. Most of the money that goes through the dispensary is going to be on recreational and relaxation, and unfortunately, sometimes getting high. And that's not what I want to do. I want to use this as medicine. But because it's not a big seller, there are a lot of places that just do rec, as it's referred to, recreational marijuana. They won't carry it because it just takes up space on the shelf. If you go to a medicinal cannabis dispensary, and you might be able to find a couple of them, you will find this, hopefully. Will it be there all the time? No. Again, it's not a big seller. But if you guys start to purchase it and ask for it, hopefully your dispensary will carry it. But you have to understand how to utilize this medicine properly so you get benefit. So I have 3 little studies that I will give you. Actually, it's 2. But a group had put together data that showed that in mice studies, they had some improvement with gagging of a mouse or rodent. They loaded the rodent with lithium chloride. That makes you gag. And then they gave the rodent a THCA, and it stopped the gagging. I think it's called gaping in rodents. But, that's positive right there. Now, you certainly have to take the data from animal studies and apply it to human studies. But aside from Ralph L. Machulum in University of Jerusalem, we cannot do that in the United States because it's still Schedule I. NIH has millions to billions of dollars to do research. And they'll do research on meditation and yoga and vitamins, but they can't do it on this because institutions are afraid that if they do research on this medicinal plant, medical cannabis, because they're doing research and getting funds from the government, they might also lose funds because they're doing research on an illegal drug. Schedule I is illegal, no medical benefit, which really is ridiculous. But politics says you can't do any research. So we're not going to have research. We have to rely on privately funded research or research outside the United States. And University of Israel, Didi Merier, the old work of Raphael Mechoulam, Jerusalem, excellent. So that's what we have to go by. And bottom line, there's no side effects. If there's no side effects, aside from paying $40, which is what I bought this for $40. And not because I'm going through chemotherapy, because I'm doing it because my patient's going through chemotherapy. I'm helping a patient get through pancreatic cancer chemotherapy. He's going through like 12 sessions of chemotherapy once every 2 weeks just to recover. And then we're going for a debulking. But I'm hoping that there will be no cancer after the 12 chemotherapies plus my guidance. And I will be doing a whole bunch of data on nutrition change that will help with cancer fighting, which is probably something you don't get from your average oncology center, and that's okay. But please subscribe to me on my YouTube channel if you're interested, and pass this on to other people. So the same group also did more studies on THCA as far as its effect on increasing brown fat. So those of you who have issues with elevated glucose, a little bit too much weight, insulin resistance, and by the way, if you're overweight and you know you have a pre-diabetes state and your doctor has not checked basic or baseline insulin levels, force them to get it, or come to see me with Herbal 411 as a new patient. I'll give you guidance and I'll order the test for you.
So the study essentially said that you can increase brown fat, which is mitochondria, and those of you who exercise know that exercise will bring on more mitochondria. Mitochondria are the powerhouses of every cell in the body, and they decrease as you get older. So taking THCA will stimulate mitochondrial biogenesis, and that's hard to do with any kind of medicine. It also increases sensitivity of glucose. So if you have insulin resistance, it will make insulin resistance go away. Now that's a big claim, but again, low side effects, $40, I think it's worth it. It'll also lower glucose. So I think it's worth it to at least attempt, those of you who have insulin resistance. So it's not just for the nausea and vomiting of chemotherapy. It might help with increasing your brown fat, making you less adipose heavy, and also making you less diabetic.
The idea is that, again, using THCA will help in animal studies, and I'm pretty confident in humans without any side effects to decrease nausea and vomiting. So what I would do with dosing this is I would, again, for practical purposes, you can take the data that was in the study and extrapolate using what they did in a formula of milligrams per kilogram on an animal, and then extrapolate it to a human. But it's a little bit difficult, and this is the only product we have. So what I would do would be more convenient dosing. I would take a dropper full of this and do it 2 to 3 times a day. With my guy who's recovering from his 4th round of chemotherapy, we're going to induce, because he usually has nausea and vomiting or decreased appetite 2 days after chemo. I'm going to start this on that day. We're going to load the body with THCA, and then we'll see if his appetite goes down or if it stays high. If we can get somebody that maintains a good appetite while they're having the poison of chemotherapy circulate through their body, bingo. You don't lose muscle protein, you maintain fuel, and you get rid of that nasty feeling of nausea and vomiting. So again, no side effects. So for those of you that are a little apprehensive, I did put this together. This is a nice paper that talked about THCA, its evolution. So essentially what happens with THCA is tetrahydrocannabinol, THC, is the active ingredient in the medical marijuana plant that is processed to give you either the flower or the vape or the edible or the topical. THC is psychoactive, so it binds to CB1 receptors in the brain and it makes you feel relaxed. Whether you just need to feel relaxed from taking the edible chocolate at night, a little bit under the tongue, I'll put a link down below on my video, or you have PTSD and you want to turn off the alarm system and you want to shut that down and just totally relax and zonk out. Or the CBD, the other component, the other cannabinoid from the plant to take care of inflammation, modulate your immune system, reduce cancer. Regardless, that's all from processing. When you process it, the biggest thing to processing the plant, to release its effect, is decarboxylation. That's the step that gives the big bang to the products, the cannabidiol, the THC. That's the big step that activates all the cannabinoids in the plant, and there's about 144. This is isolated before you do decarboxylation, so there's no psychoactive effect of this. So number one, you don't get high. So if you're looking to get relaxed with this, it won't happen. So my folks who need their edibles at night or their vape at night or their flower at night, it's okay, you can still do this, and it shouldn't affect your current dose, so you should still be able to get your sleep or use the rescue for your PTSD. Quarter to have a dropper twice a day to 3 times a day. It should not affect your relaxation if you're going for that. It should not affect your insomnia formula that you use as far as medical cannabis, and it shouldn't affect your CBD formula that you're using for Crohn's disease or inflammation or fibromyalgia. So I think that this will help not only for my folks that are doing the chemotherapy, and I would induce, if you do chemotherapy and usually get hit with the side effects within a day or 3 days, I'd say the day before those symptoms usually come up, try this, and then continue this until the symptoms usually go away. In most cases, when you pulse the chemotherapy, there'll be a little bit of an effect, and then it'll go away as far as bad side effects. So I would just put this layer on a little bit before, and then during the time that the symptoms or side effects occur, and then save it for the next round. So that's how I would do it for chemotherapy. In the case of my guy who's going through pancreatic cancer, since his usual symptoms are tomorrow, that's 2 days after the chemotherapy, I'd say maybe tomorrow or tonight, load up with this 3 times a day, half a dropper. And if the symptoms typically last about 4 days, continue over till the 4th day and then put it away. At the same time, we're going to continue with CBD dosing. We might continue with the edible at night because we still need that. And again, this does not do anything with regards to getting you relaxed. It won't help with sleep. And as far as its immunomodulatory effects, the CBD that I'm giving to my patient in dropper form, grassroots, I believe he's taking, I would still continue with that too, because the CBD out of the plant, and I'll put a link to my video on that tincture, it does help with immune modulation, helps with COVID in case you have it. It helps with decreasing inflammation, and I think it'll help with cancer and definitely the aches and pains of the chemotherapy. So I'd continue the CBD, I continue the nightly THC, and I would add this to beat down the effects of nausea and vomiting or decreased appetite. Hopefully this gives you a little bit of an idea what to do. Check out those links that I just showed you on the papers. I think they're very helpful, especially the last one if you're interested. If you're chemically a geeky guy or gal, the last paper I gave you is pretty cool. If you have any questions on how to use this, if I spoke too fast or too many words or acronyms, put the questions down below. I'll be able to answer them. Or if you need help because you have the medical cannabis card, but you have no idea what you're doing and the bud tenders are not giving you guidance, which is fine. They're not supposed to. I'm supposed to give you guidance, me and my cannabis coaches. Come see me on my website, Herbal 411. It's either a new patient consult, and I can give you a full hour and a half of what to do, dial in your nutrition, work on exercise, work on mindful practice, or click on the medical cannabis consult link, and you'll see what me and my friends did with Mixture. It's a company that I started to help give my patients more empowerment with regards to choices at the medical cannabis dispensaries they go to. We still have to get through this COVID crap, and don't forget to subscribe to me because I'll be doing a follow-up video on what to do with regards to eating, in addition to other things as far as medical disease later on. Thanks, stay safe, and I'll see you at the next video.